Next is the slit lamp examination. So the slit lamp is used to examine all of the anterior segment structures from the lids and eyelashes all the way back to the lens and the anterior vitreous. So these are the parts of the slit lamp. We have a screw here that keeps it in place, so you make sure you unlock that. There's a joystick, you rotate it to go up and down, and then you can make small movements to the side, or you can push the whole instrument from the side for larger movements. Usually there's an on-off switch somewhere down here. And then in this case, we can adjust the brightness of the light. So we're going to get the patient to come forward here. And we need to make sure that it's the appropriate height for them. So the chin rest has to come up in this case. We want this little line on the side to line up with the side of their eye, essentially. This little swing arm houses the light beam. So we can adjust the width of the light. So we start by sweeping across, looking at the eyelids. And you may want to change the angle of the beam to make it appropriate for you. The beauty of the slit lamp is that you can look straight ahead and use a beam that's coming in from the side, which means it will illuminate a cross-section of a clear structure like the cornea. So here we're sweeping across the cornea. And we can change our magnification. Usually on the barrel there's going to be a dial that you can turn to adjust the magnification. And as you push forward, you'll focus deeper in, so we can look at the iris then. We can look through the lens. This is a clear lens, but if it was brown or yellow, that would indicate a cataract. And we could even push further forward to look at the anterior vitreous, which in this case is clear.